Thank you for joining today's webinar on Medicaid renewals and partnering with faith communities. My name is David Jordan with United Methodist Health Ministry Fund. Today's webinar will cover what is Medicaid, why it matters to Kansans, especially Kansas kids and families, what is the Medicaid renewal process, and then how to partner with faith-based communities. We hope it's informative, and then at the end of the presentation, we have time for a robust discussion. I want to thank the Community Care Network of Kansas for co-sponsoring our event, as well as all of you for joining us today. This spring, Kansas, like other states, resumed the Medicaid renewal process for the first time in 3 years, and we are working with partner organizations to spread the word and doing what we can do to help folks navigate the process. This is the third in a series of webinars that we did. The first two really covered the basics and then offered tips for on the ground re-enrollment efforts. And if you're interested in those, you can find them on our website. We have a few great speakers, Kate Gramlich from Community Network of Kansas, who's leading efforts to bring partners together around the Medicaid renewal process, and Katie Schoenhoff, our Director of Programs. Now some quick housekeeping items before we get started. Given the number of folks on this call, your lines are muted. However, we hope you can use the chat function to engage throughout the webinar. And then later on, we'll open it up for open discussion. But for now, could you please introduce yourself in the chat, name, where you're located, and if you're from a congregation, please share that as well. Please use the chat to ask any questions throughout the presentations. We will also use the raised hand function. So feel free to put that up and we'll call on you too when we open up the line. So please ask questions throughout. Please note questions in the chat. We want to make sure there's a robust discussion. The agenda for today, I'll just kick things off with some opening remarks. Kate Gramlich will then follow. She's the project manager for the Cover Kansas project at the Community Care Network of Kansas. She'll really give some more technical background, and after Kate's presentation, we'll take a few minutes to ask questions and answers, going to the chat, going to raised hand, and then just opening up for folks. So if you have questions about the process, Kate will be there to answer them. Katie Schoenhoff, our great Director of Programs, will then just talk about some resources that exist on how to engage faith-based communities. We really hope to then have a discussion with all of you about what tools you may need, why this may be important, and different things that we can consider in supporting you, but really how we can better engage faith-based communities in the Medicaid renewal process. That's an overview of the presentation. And please put any questions in the chat. Thank you again for joining us. Just to put this into context as to why this is important to faith-based communities, currently, our Medicaid program, which is the state's healthcare program for our most vulnerable neighbors, serves approximately 400,000 Kansans on normal years. Because of the public health emergency, close to 500,000 Kansans were enrolled because nobody could be disenrolled during the public health emergency. The bulk of the Kansans enrolled in Medicaid are children, low-income parents, and Kansans with disabilities. So truly our most vulnerable neighbors. And in some rural counties, approximately 50% of children are members of KanCare. So as we think about the folks that are in the pews in our congregations, we know that many of the children are enrolled in KanCare, and losing coverage could have really significant consequences on their health and on families' economic security. So we want to make sure that as we start to renew coverage for the first time in Medicaid in 3 years, that folks are not losing coverage because they failed to update their address with the state, or they failed to turn in paperwork that they didn't know that they should look for. In Kansas, because we have not expanded Medicaid, the folks most at risk of losing coverage are children and families. And we know from a faith-based lens, we need to make sure that we're taking care of the least among us, as well as ensuring that families have the healthiest start to life, taking care of our children in the next generation. This unwinding of coverage, the need to renew coverage, started earlier this year, and April. Some Kansans have already lost coverage disproportionately. We know that kids are going to lose coverage, and a primary reason is lack of awareness, which is why we're having events like this. So we need to make sure that we are talking with folks about simple things like looking for their mail and updating materials. And Kate can really get into that. But we're excited for you to join us. We want to find ways to partner to lift up this important discussion. So thank you very much, and I'll turn things over to Kate.
Thank you, David. Hello, everyone. I am going to go ahead and share my screen here. Thank you. So as David said, I am Kate Gramlich. I am Cover Kansas Project Manager for Community Care Network of Kansas. Essentially, our project is helping folks across the entire state connect with insurance options, either through the marketplace or whatever their best option is. And we've been working with the state and some other partners on Medicaid renewals, since it's such a huge topic nationwide, and the rules can be kind of confusing. So happy to be here, and apologies, I have a little bit of a cold. So if you don't understand something I say, or you want me to go back or something, please let me know. I'm happy to. So we're going to do a brief introduction kind of on what CanCare is. I just wanted to start with the basics. I'm sure many of you are familiar with the program, either through your professional life or through your personal life or family and friends. But I wanted to make sure that everyone's kind of on the same starting point. So if I can work in PowerPoint. Okay. So CanCare, as was mentioned, is Kansas Medicaid. It's providing health insurance for adults and children who have limited income and limited resources. So it's really providing, like David said, care and access to health and opportunity for folks who are in the most need. CanCare gives people access to, doctors, to immunizations, to all the things that keep us healthy and keep us, part of our community. So primarily in Kansas, it would be, like you've mentioned, children, pregnant and postpartum parents, elderly adults, and people with disabilities. And it covers a wide variety of services that are really, really helpful for families, especially helpful for kiddos. Prenatal care, doctor's visits, immunizations, school physicals, prescriptions. So the list goes on. There are a lot of benefits that are provided for people who may not otherwise seek health care or health insurance. So I wanted to kind of give you a brief glimpse of what kind of numbers we're talking about here. And I've been looking at the chat and kind of looking at where you all are tuning in from, and really appreciate you all being here. And we've got a map of the Kansas counties here for children. I'll show you the whole. So it's children enrolled in Medicaid or CHIP by county, and this is for 2020. So this is at the beginning of that, the pandemic period. And this was before a lot of people actually joined CanCare. So we can assume that these numbers are actually higher in the majority of these counties. So you can see, as was mentioned, in rural and in some urban counties, the population or the percentage of children in those counties who are on Medicaid or CHIP is just, it's enormous. So, we've got coverage here in the southeast corner of the state. But then also, there's pockets of counties where folks, there's very high percentages. So these are a lot of kiddos, and it actually gives you the number at that time of kiddos who were in each county. So it really puts a number to the issue. And you imagine, you imagine in Sedgwick County, over 61,000 children. So this is showing how big of an impact it has, and you can look at your area in particular. Again, these numbers are likely to actually on the screen be lower than what's in reality, because a lot of folks joined Medicaid and CHIP during the pandemic after jobs were lost, after circumstances changed, and they needed the assistance through Medicaid. So what has changed? Okay, and why is this a big deal at all in this Medicaid renewal situation? So in 2020 to 2023, there was a public health emergency, and one of the things that was involved in that was that no one, as David mentioned, could get kicked off of CanCare or Medicaid nationwide. The only way someone could lose their benefits was if they moved out of Kansas, if they elected to cancel their benefits, and then also if they passed away. So otherwise, families were able to maintain, health care for their kiddos and for themselves throughout the pandemic. They were able to actually access, dental care and all the things that we all need to kind of keep running. They were able to do that without any risk of losing coverage. So this was a really big deal. Nationwide, unfortunately, or for whatever reason, the public health emergency then ended, and we are kind of returning back to quote unquote normal, the operations that were in place before the pandemic. So annually, what had happened before that 3-year period is that the families who are on the households that are on CanCare, they would have to do a renewal forms every year. You prove eligibility, you report income, any kind of changes in life circumstances, report, your household size, whether you added family members or what have you. So that was happening every year for the families and the households that were on CanCare. However, I mentioned that those numbers on that map were actually lower than current, and that's because there was an increase in enrollment for parents, for kiddos, for folks with disabilities. Also, all across the board, there was an increase in CanCare enrollment throughout that period. So all those folks who joined in those 3 years have never had to do a renewal. They, may have not known that that is something that was happening for, the decades beforehand. Also, the folks who had done it before may not remember. I don't remember what I did last week, so I'm not sure that I would remember the entire renewal process that happened 3 years ago. So we're trying to reach folks who there are folks in your communities who have either never done these renewals and don't know the significance or the process, or they just haven't done them in years and don't recall the specifics. So what happens is that starting this spring, households need to fill out their paperwork to renew, and we'll go over kind of what that looks like and how that comes to the family, or else they lose benefits regardless of their eligibility. So, I could be a mom with 10 kids on one income and would obviously benefit from this, and my children are on this program. But if I don't renew and send in my paperwork, we will all lose benefits, the kiddos and all, regardless of actual eligibility. So a main issue, as we can see, is that lack of information and lack of awareness, like David mentioned, that leads to losing coverage without knowing why. And when parents are unaware, the children are especially vulnerable, because children, aren't checking the mail and filling out these forms. They are at the mercy of their parents and guardians. So we really need to connect with these caregivers and help these children. And again, if you need me to go back or slow down or anything, please go ahead. I'm keeping an eye on the chat in case there's any issues. So each state has tackled this renewals situation differently. Kansas, just kind of a bit of background information, technical information. We started the renewals in March, and so the first batch of households received their renewal notice. It was about 33,000 households in March. From that, we kind of go chronologically every month based roughly on when the family, the household started CanCare. And again, even if I was on CanCare for years prior to the pandemic and the public health emergency, I may not remember exactly when I started CanCare, and I may not exactly remember when my renewal month is supposed to be. So we're trying to help prevent as much confusion and coverage loss as we can by giving this information to you all. Like I said, around 30,000 households are processed each month. So that's an enormous amount of people that are on the CanCare roster. The notices are sent each month by postal mail only. And as you might know from folks in your own community or your own life, many folks have moved within the last 3 years, and they may not have updated CanCare with their correct address or done a mail forwarding or change of address request. We likely know that, folks who are in crisis and who are, just working hard to survive and support their children the best they can, they may not, you're not necessarily thinking about, oh, let me make sure that CanCare has my correct address, or let me make sure that I've checked all of these boxes. You're more just trying to provide shelter and food and safety for your kiddos. So there's lots of folks who have moved or moved several times, and they are not going to receive their renewal notice in the mail because their address is not updated. So that's another space that we can step in, and I'll show you a way that we can do that. Like I had said, if you don't respond to that notice, regardless of eligibility, your coverage will end after that due date. So, for example, the first renewal notices that were sent in March, they went out mid-March. They were due to the CanCare office by April 15th. And then if they did not send them in by that deadline, there was families who lost coverage completely on May 1st. So we can dive a little bit into that data, or I can just link to it so you can kind of see how that's laid out. But the point is that there are households who have already lost coverage regardless of their eligibility. And now the positive thing is that CanCare has built in a system of 90 days to submit that renewal paperwork after you lose coverage for potential backdated coverage. But likely any sort of, pediatrician visits or things like that are out of pocket until then, and that's just not affordable for a lot of folks. So you can see there's a lot of kind of building risks that go with this. So basically here we've got, if you don't have access to mail, you may not have access to health insurance. So we're really trying to raise awareness of the importance of this and ways to either prevent coverage loss or help get it back if you do lose it. So how can we all help? Well, you all all those who are tuning in who are part of faith communities and your own congregation, you know that you are a vital resource for your community, especially folks in smaller or tight-knit communities. You may be the town's therapist and resource, connector and their lifeline, really. And so you have a huge role to play here if you're able in continuing to help the folks in your community. So some key messages to remember, and these slides will be available after here. I'll have some links coming up shortly that we can explore. Just remember, so all households are going through a version of the renewal process. And it's not based on eligibility. It's based, the members are going to have to renew annually. They're not going to be just seen as automatically eligible in a lot of different cases. If a parent is or a guardian in your community is no longer eligible for Medicaid, a lot of times they might think, well, I got a job, I make too much. So my kids are probably also kicked off. And then that would be a reasonable assumption, but it's likely that their children actually still can stay covered because the household income limits are higher for kiddos than they are for adult coverage. So that might be something that you face as someone saying that they wouldn't, qualify. So why even bother with the renewals? And it's because their kiddos could still be covered and save them that cost. If one thing that we've learned through working with some partners is that if you've got kiddos in your congregation who were in foster care, they would have been covered by CanCare previously, through the foster care system. But once they are able to be reunited with their parents, the parents do need to reinstate their benefits and start this process of their annual renewals. So that's tangentially related to the renewals, but it's a note I wanted to make since this may be the case for a lot of families in your congregation. Also, the parents may say, well, I could just reapply. Why don't I just send in an application? I didn't get my renewal form. I'm just going to turn in a new application. And that's okay. It will eventually get processed. But the renewal form is about half as long as a new application. So you would encourage them to kind of save time and renew instead of reapplying. Pardon me. So what can we do with this information? We've got several resources that we are able to share here. Let me see. So first I'll talk about a tip sheet that has some information that's easy to kind of share with your community members. It's printable in English, Spanish, as well as 15 other languages. And it gives some kind of quick tips and tricks on navigating this process. There's also a way we can help folks with updating their contact information that I can go through. And then there is a dashboard or a big collection of resources that has a lot of things that you may find interesting and things that you can share. So I will walk through those resources here. All right, so the tips sheet, which is linked in those slides, it's also on that dashboard. I will go over some of this information with you. Is everybody able to see okay? Let me know if you need me to enlarge it. So this gives some basics about what I have already gone over with you, postal mail, based on date of enrollment, need to respond regardless of what you think your eligibility is. But it gives a little bit of a breakdown on how you can help folks do this. So again, if their information has changed, they can call the CanCare Clearinghouse, or they can also call their Medicaid insurance provider, the number on the back of their card, which may be more comfortable for them. It may be less time on hold. It might be just someone that they have already, a hotline that they've called before. So they're able to do it that way. We can also help them with an online little identity verification tool that I can show you in a bit. Another little tip is that if you've got folks in your community who are without a home address or between addresses or are have precarious housing, they can submit a friend or family member's address where they have access to checking their mail. So if someone comes and is worried because they are moving, ask if there is a steady address that they could have access to checking. That doesn't need to be, there's not like proof of address of residency at that address required. You just want to make sure that they can get their form. When you, let's see, if you have not received your renewal packet, it might be that as long as your address is updated and your information is up to date, it may just not be their time yet. I had that chart up there with a little bit of a calendar, I think, unless I did not do that, but it's about 30,000 households per month Yeah, and so their month may not be until October, November, December, or early next year. So if someone wants to know when their renewal month is for their family, they can call that clearinghouse number again, or again, they can call their Medicaid provider on the back of their insurance card to find out what their renewal month is. This might be a helpful way that we can help folks, encouraging them to call to plan ahead if they are concerned about not missing the deadline. Have them call or sit with them to call if at all possible, and find out when they can be expecting their paperwork. Also to kind of verify that their address and information is correct. If they need to, there is a voicemail option, and this will kind of cut down on some wait times and help the clearinghouse move through calls and get back to that consumer, that person when they have availability. Let's see. Sorry, my notes. Okay, so after they have, they've found out when their renewal month is, their address is up to date, they are ready to roll. After that, you check your mail, and return the paperwork as quickly as possible. So I had mentioned before that, for years, no one has had to do these enrollment or the renewal paperwork. So they may be just tossing what they get from CanCare. That's common. I toss a lot of things I probably shouldn't, but so they may not know, to open anything that comes from CanCare. It should come from CanCare or the CanCare clearinghouse. And it will likely have the information in it on how to renew. So check mail frequently, open mail from CanCare, and then return it as quickly as possible. The due date is listed on the letter, and that is a very important due date. We don't want to risk, delays in mail or, technical difficulties by putting it off to the last minute. So whenever possible, it's helpful to encourage people to do things early, just to kind of give them a heads up. So, pardon me. So when they return their renewal paperwork, one thing to emphasize that makes it a little bit easier is that it is okay to send an incomplete form as long as it is signed in all of the places that ask for a signature and dated. So if they're waiting on their pay stubs or waiting on some proof of income or something like that, don't wait for that. Just sign it wherever it asks you to and send it in immediately. CanCare will then follow up with what they need, but in the meantime, your kids will stay covered. So that might ease a little bit of nervousness if they're waiting on documentation or something from their employer or whatnot. So make sure it is signed, even if it's incomplete. Sign it, and date it, and then send it in. If they miss the deadline or did not receive their form because of incorrect information, they will lose coverage after the date that's specified, but they will have 90 days to resubmit their paperwork. So if they find it in their junk drawer, send it back in, sign it and send it back in as soon as possible. It'll get processed, when it's available, and they'll hear back from CanCare about their status. Any kind of any medical costs, though, in the meantime, will likely be out of pocket until that reimbursement is approved. But let's see. Okay, so another way that we can help is if your congregation or if your organization has fax still, that is a really nice way to assist folks in faxing it for them for free. They can go to the public library, they can go to a couple of other places, but if you are able to, fax that in with them and then kind of hang on to a copy of their confirmation sheet, that would be a huge way that you can help. It would offer some peace of mind. It would offer backup information in case something gets lost. You'd be able to assist them with that. So that is a really nice way to help folks. Pardon me. So we've got, I also mentioned a way to help folks update their address online. And I've got a video that I've linked here. Oh, you can see my good. I was looking at baking goods. So I've got a video that you can watch that's just a few minutes, and it walks you through every step. But just to give you a really 2-second preview, if you go to the CanCare website and you go to the bottom here, there is a little chat icon, and you would be able to walk through choosing the language, and then walking through kind of the verification steps. It'll ask you a few questions. It'll ask you for method of verification, like social security number or member ID or something like that. If they have that information, they'd be able to walk through and update their address. This is very helpful if you're helping people, let's say on a Sunday when the CanCare clearinghouse, or when CanCare is not open, or, if it's a time when they're not able to reach the clearinghouse. Helping folks walk through this, whether it's on your computer or your phone or tablet, would be very, very helpful. It kind of, again, eases the burden and lends some peace of mind to people who are going through this process. So we've got that video that is available to watch. It's right down here. It's also linked in the PowerPoint. We've got it in English and Spanish. That'll walk you through that chat bot. And then also the third link on the resources page that I mentioned is this dashboard. This is kind of constantly evolving. We're adding resources as we get them. We've got those tips that we talked about. We've got a basic renewal flyer that's from KDHE, or Kansas Department of Health and Environment. We've also got a specific handout on making sure kids stay covered. It's the information I've already given you, but it's in kind of a colorful, there's cute kids on it. It's maybe a little bit more aesthetically pleasing. You could have that out. You could put it on your bulletin board. You can send the file. There's a lot of different ways that you can use this, but it gives some of those quick tips without being too overwhelming. We've also got access to a couple of different flyers as of now in 15 different languages besides English and Spanish. So that is helpful for folks in your community who are speaking languages outside of English and Spanish. We also have a lot of there's questions that can be answered here. There are, ways to access media to post. I will say one quick way to share things on Facebook or over social media is you can go to our Facebook page, and we've got new information you can easily share it. You don't have to download anything, just go ahead and click share. You can share it on your personal or your organization's Facebook page. There is information. We've got this webinar series that we have been putting on. There's links on the Health Fund website, and I've also got them here in case you'd like to watch them there. But there's a lot of different resources on that dashboard. And so for now, I will open it up to questions. I will say that if you want other information on this whole issue, kind of as it affects nationwide, there's a call similar to what we're doing, but kind of on a larger nationwide scale in a couple of weeks, maybe that's in 1 week, on Zoom as well. So you'd be able to access that. And I see a couple of questions here. Okay, so pediatric or family practice clinics, contacting those who've had coverage. Yes, so that's a great question, Kathy. We call them MCOs, but the Medicaid insurance providers. They are contacting providers, whether they're pediatric or other types of providers, primary care physicians, et cetera, who they can contact them with a list of folks who have a renewal coming up. And a lot of times those practices are texting the people, kind of sending an automated text, or they are doing, sending an email or with an invoice mentioning that they have a renewal coming up. So that's a really great question and a great idea. And if you've got connections with pediatricians in your area or other kind of family practice providers, I would say to ask them if they're aware of, and if they're receiving those notices. They if they have any kind of issues with that, I can help connect them with how to request it, but I'm hoping that they are already receiving these. They may also be receiving them and not, know exactly what to do, or not understand the kind of the gravity of the situation, or they're just extremely busy. So now you kind of have some information to have that conversation, or you can refer to some resources if they have questions. Excuse me. Another, let's see. Oh, good. Okay, so Samantha says it's a good point about not receiving mail if address is not updated. It is easier to keep up with physical mail sometimes than email, because it is right there in front of you. I can't, really paste an email on my refrigerator to remind me as easily. But yeah, so not having that address updated though is huge, because no form equals no health insurance, unfortunately. Let's see. Can a church address serve as a postal address for a family? I believe that would be up to that organization. I don't see any, I don't think that would be an issue. If that's a can of worms you're willing to open, that's just a beautiful thing to offer. There are ways to kind of act as a facilitator on someone else's case, where you would receive the exact same things that they're receiving, but that may, give more information or more access than that person is comfortable with. So if they're comfortable using your address, I think that that's a beautiful thing to offer. Any other question? What else you got?
Any other questions folks have?
If you think of anything, hop on, but I will hand it over. I'll stop sharing and hand it over to Katie then. Oh, where can you access these materials? Perfect. We, Health Ministry Fund has a great resource website that has all of these previous webinar recordings, and they'll be putting this PowerPoint up there. And there's a link to like that dashboard that I went over as well. So, and if you, my email address is all caps here, but it's certainly not shouting at you. But if you have any questions on what I went over, let me put that in the chat here. Go ahead and email me, and I'm happy to talk one-on-one, or provide the information in a way that's easiest for you. So.
Great. Thank you, Kate. And please add other questions to the chat. We'll have other time post after Katie's presentation to discuss, so you can jump in there too. So we'll turn things over to Katie.
Well, thank you. And again, Kate, very helpful information, context, I think, and even the resource pieces. Again, we'll try to make that as easy as possible for you all to find those afterwards. So I think what we'll be doing within the PowerPoint slide decks is having those be clickable links that you can go straight to, and it will put you in those locations. So as we were talking a little bit about just what responses that we have, we recognize that faith communities play a key role as a community hub for many people, as well as a trusted messenger for information. This is one of the pieces that I would say is United Methodist Health Ministry Fund. We work alongside a number of churches within the United Methodist denomination, but also recognizing that this correlates with many different faith communities, and we just wanted to take the opportunity to talk about maybe some opportunities that might make sense for you and within your congregations or within your faith communities, and then also thinking about what partnerships you may have that make the most sense for leveraging to then make sure that more people know about this. Because again, as Kate mentioned, this is a crucial time for many families, and to have potentially families or people with disabilities to lose services and coverage is a really concerning thing. And so we just want to do everything we can. And we know that you all are meeting with people regularly, talking with a variety of people, and just making sure that everyone is aware of what's going on. We think it's just a really important message to carry forward for the next 6 months. So I'm going to go ahead and move forward into this and just, oops, sorry. I'm advancing too quick. So again, as I said, like as trusted messengers, we recognize that there are different ways that you all work within your communities. One thing that I would just encourage you all to do, for those of you who are clergy or familiar with ministerial alliances within your community, I think that's a great opportunity to take some of those posters or just resources and say, hey, some of the ones that Kate even mentioned that have the QR codes, or anything like that, that would be something that could be used for sharing the information and just trying to get word out as best as possible. Again, if you're serving in rural communities or part of those communities, we know that there are a lot of kids that could potentially lose coverage, and that can be a challenge for many of them, especially as we're going back to school. And so that's another thing that I would just encourage you to think about as well. So once you look on here, the coordinating with local partners, one thing that I would just let you all know too, many of you may be aware of this, but I think it's just a good reminder. You know, there are navigators and different groups like hospitals, health centers, libraries, that those are places that people naturally are going to anyways. So if there's ways to work with, say you already work with your hospitals or your health centers, also libraries are doing a lot around this already, but I think it's another key opportunity. Maybe it's like promoting it or having events where you could say, hey, we're working with the library and we'll have someone here just to help walk you through and help people feel more comfortable through that process. Sometimes it's just a challenge to know where to go and how to get started on that. And if you have some that are comfortable, that's a really great service that can be provided by some volunteers within your congregation. The other thing I would mention is that many health centers or hospitals or different groups have access to what are called navigators. And so that's another thing too, that you can utilize community health workers, other groups that might be able to help you go in and figure out how to help others enroll and support them through that process. You know, I know a lot of our congregations that we work with too are also working within the community, within the school districts. Like some of them have adopted schools. I think this would be a great thing as we're talking about going back to school here soon. Many of you are either doing events or I think this is a good opportunity before kids like are needing to be vaccinated for returning to school to make sure that families are aware of this. And so working within the school districts, we know how busy the schools are too. And so I think if there's the ways that we can partner, leverage our relationships and work together, it would be a very beneficial piece of that. And then the other thing that we know is some of these same people don't have access to internet within their homes. So I loved Kate's idea about what if you did it on a Sunday when they're there for services already, or, you know, a Wednesday night, or you could have an event where you could have people come in and do that. Again, I also loved the mention, Brenda, about just being potentially an address. That's something I wouldn't have thought of, but again, that's a really you know, tangible way that we can help support those that may not have an address that is viable for them. And then again, working to do outreach events would be another idea for that. We really wanted to just open this up as an opportunity to talk about potential ideas that you all may have too. But before we go into that, I did just want to share some resources that we have at the Health Fund that we've developed over the last couple of years that might tie in and work really nicely with this. So one of the things that we developed last year, kind of in response to COVID pieces, were these sermon guide series. And we have 7 different series that we've developed, but I did want to just highlight one specifically, not that the others wouldn't work for this too. Some of them are tied in with different forms of health, but we really use this to talk about how health and faith and the intersection of that, and ways to bring these topics up within your faith communities. And so these resources were developed to provide context and guidance on topics around these type of things. And so these are for clergy or congregations, but can be tailored, I would say, to what makes sense for you and your congregations or for your faith community. And so one of the things that it has calls to worship, there's some on children's sermon, hymnal selections, and then bulletin inserts and resources. And then we also have like a full list of sermons that you can use and tailor. We call them quote unquote plug and plays, but really you can use as much or as little as you want of these resources. They're free. And so that may be something to help guide this week too, that we have a picture of it that's called the Body of Christ in Child Health and Wellbeing, but week 2 is called Let the Little Children Live. And that one specifically focuses, there is some content in there about CHIP and Medicaid services. So that may be a quick way to go in and pull some information. We tried to put some data in there as well that might be helpful for you to do. So that was just one tool that I wanted to make sure that you're aware of. Again, these links will be in the PowerPoint slide deck, and you'll be able to click straight to them to go to the links and find the information on our website. But Dashanika also pointed to that within the chat as we were going through. The next one that we have also developed here is, thank you, Dashanika. The other one that we put forward here is our social media tiles and church bulletins. So these are a couple of other things we quickly pulled together to just have for you all if you wanted to do something that talks about that you can use and post. We think it's, again, any way that we can get the information out and help support, we see as very beneficial. So we just wanted to have some other resources for you all to be able to utilize and share. Again, the left 2 are the social media tiles, and the right one is a bulletin insert that we just developed specifically that talks about this issue. And lastly, one of the things that we just wanted to highlight is that the toolkit that we have found, there's one that's specifically for faith communities that was put together by the American Cancer Society. This one really is more general, I'll be candid, but it really explains to you how to talk to different faith communities, how to make sure that the messages are pertinent to them, and how best to make sure that it might make sense for them, and what might be most relatable depending on different faith communities. And so I did just want to make sure we shared that as well. And again, that's a little bit broader, but I would say it's another tool that might be helpful as you're talking to other groups. So I think the last piece that Kate mentioned as well, that before we kind of go into some open discussions, was we joked this morning, we just found out about this webinar that they're doing August 23rd, and we feel a little ahead of the gate, but I think that's good. So this gives you a week up on being able to start trying to promote this and get word out again, so that hopefully less families are losing coverage, and that we're doing everything we can to help promote and encourage those to be able to have access to healthcare. And so this right here is specifically from the Department of Health and Human Services and Centers for Medicare and Medicaid for a webinar specifically around faith and community organizations and how best to do that. They will have a toolkit that they're sharing. They don't have that released yet. So that may be another place to find some additional resources. And we'll try to promote that out to you as well, if you all are comfortable with that, since we have your information and know this may be a topic of interest for you. So I think those are some different places, again, that we wanted to just have some quick resources available for you to get the message out as you would like to. But again, we wanted to really then take the time, since we have that here. And again, you'll be able to use this whole slide deck for all of the resources and quickly click to those. So I think that the next piece is really like, let's just open it up for questions or discussions. Does anyone have any great ideas for where you see your congregations or faith communities being able to work within your different groups, or I would say within your communities, to help support this area of like cane care re-enrollment? you can either put it in the chat, or if you have any great ideas. I hope this generates some ideas. Does anyone have any thoughts on this? We can also open up for questions, Jeff, if you want to take people off of mute. Yeah, if there are health fairs with free screenings, that may be a great opportunity for that. If those are already occurring, you know, that does happen typically sometimes in the fall. So it might be a good opportunity for that. Great thought.
Katie, I can share that article that we found about the churches in Indianapolis.
Oh, that's a great idea too. Ooh, yeah, that's a great idea. Housing authority in your town. One other thing we talked about was like at food pantries, putting those flyers in as you have them. I know a lot of faith communities work there, so I was going to say that may be a great idea to have it. Again, where you see natural places where people are going. I think that's a really important one. You know, I think, again, anything that we can do to kind of work together as a community to try to get the word out as much as we can. One other group I know had mentioned maybe even talking with city about putting it in water bills, or like, how do you do it within utilities or other ways that cities get out information, if there's ways to do it there as well. And again, maybe it's not reinventing the wheels, but working with others to do it. Oh. It's okay, so we can't unmute everyone all at one time, but if you would like to, you can go ahead and unmute yourself and offer any ideas. Thank you, Jeff, on that. Any thoughts from the group? Love that. Sending kiddos home from Sunday school or youth group with info for their parents, you know, and I think that's a great idea. The other one I had thought of too is we had a number of our churches that we work with that provide meals on Wednesday nights. So, you know, they're there. Maybe that's a captive audience for then when you say like, hey, you may not be needing services, but there may be someone you might know. Here's where you go. And again, what I loved about what Kate shared too, you can do it on your phone. And that chat feature, we've heard a lot of our community health workers that we partner with say that's been a really helpful function for them to be able to use that specifically to go in and make sure. I love that. The Shabbat dinners for Jewish communities too. Great idea. Yeah, I think anywhere that you can find where, again, people are generally gathering and finding opportunities for sharing that is really great.
If anybody has events coming up this fall and you'd like some access to printed materials, or you've got questions about, you know, what you could provide or what we can help with, feel free to give a shout out to, you know, any events that you have coming up, or you're welcome to contact me then about getting some materials.
Thanks, Kate.
And likewise, if there's resources that you think would be helpful for us to help create, let us know. Or if you have concerns about weighing in on this topic, or it may be too technical, use us as a resource, or Kate. We know that there's many folks that are in the pews that have children that may be at risk of losing coverage, and we want to make sure that you feel comfortable in having these conversations or have tools that can help you engage with folks. You know, we focus a lot on how to improve access to coverage, and this is just as important as people that have coverage not losing it. So we want to make sure we support those efforts and to be there to support these conversations. So please engage with us going forward, and just want to thank Kate and Katie for their presentations and the team at the Health Fund for supporting this. So with that, thank you all for joining us today, and we will follow up with the materials and the presentation, and the recording will be on our website. So thanks so much and have a great day.
Thank you all.